Today, I would like to explain the introduction of hearing. Before we tackle about the hearing, I want you to know this phrase: hearing is one of the special senses. Hearing is the sense through which a person or animal is aware of sound or ability to hear. So, introduction of hearing. The air. Hearing in balance. At first glance, the machinery for hearing in balance appears very crude. Anatomy of the air. Anatomically, the air is divided into three major areas: the external or outer air, the middle air, and the internal or inner air. Hearing, the sense through which a person or animal is aware of sound or ability to hear. External air. External air. The external or outer air is composed of the auricle, external acoustic matrix, and tympanic membrane. So, when we say auricle, structure surrounding the auditory canal opening. So, the external acoustic matrix is a short, marrows chamber carved into the temporal bone of the skull. And the tympanic membrane, sound waves entering the auditory canal eventually hit the tympanic membrane. So, the middle ear is under of the hearing. Middle ear is classified in openings, pharyngotympanic tube, and ossicles. When we say middle ear, the middle ear or tympanic cavity is a small air-filled mucosa-lined cavity within the temporal bone. One is under the middle ear is openings. Openings is tympanic cavity is flanked laterally by the eardrum and medially by a bony wall with two openings, the oval window in the inferior membrane covered bound window. The toe is pharyngotympanic tube. Pharyngotympanic tubes run obliquely downward to link the middle ear cavity with the throat. 3 is ossicles. Ossicles, it is spanned by the three smallest bones in the body. One is the ossicles, which transmit the vibratory motion of the eardrum to fluids of the middle ear. And the internal air, the internal or inner air. So, the inner air is classified into four. One is subdivisions, in one is perilymph, and three is membranous labyrinth, in four, or the last one is endolymph. So, when we say internal or inner air, it is the internal is a maze of bony chambers called the bony or osseous labyrinth, located deep within the temporal bone behind the eye socket. 1. The subdivisions. Subdivisions, the three subdivisions of the bone labyrinth, the spiraling pea-sized cochlea. And 2 is perilymph. Perilymph bony labyrinth is filled with a plasma-like fluid called perilymph. The 3 is membranous labyrinth. Membranous labyrinth. In the labyrinth or perilymph is a membranous labyrinth, a system of a membranous membrane that more or less follows the shape of the bony labyrinth. The last one is endolymph. The endolymph or the membranous labyrinth itself contains a thicker fluid called endolymphia. So that's all.
In this part, I'm going to talk about the importance of hearing. Hearing is very important and essential in helping us communicate, socialize, and work throughout our lives. Hearing makes it possible to engage, listen, look, and enjoy many of the things that help shape your quality of life. Hearing is our most social sense. Our ability to hear allow us to talk with friends and family, to enjoy music, and to relax, listen to the sounds of nature. As one of our most important senses, the ability to hear enable us to connect to the world. More importantly, hearing connect us to the people, enabling to us to communicate in a way that none of our other senses can achieve. So the ear is divided into three main parts, which include the external, middle, and inner ear. The external ear include the auricles or pinna in the external auditory canal. The external ear terminates medially at the tympanic membrane or eardrums. The external ear, the auricles or pinna, is the fleshy part of the external ear on the outside of the head. So it consists primarily of elastic cartilage covered with skin. Its shape helps collect sound wave and direct them toward the external auditory canal. The external auditory canal is aligned with the hair and ceruminous gland. That ceruminous gland are skin gland that produce ceramen, a modified sebum, common called airwax. The hair and ceramen help prevent a foreign object from reaching the delicate tympanic membrane. However, overproduction of the ceramen may block the canal. The tympanic membrane is a thin, semi-transparent membrane that separates the external ear from the middle ear. It consists of three layers, assembly cuboidal epithelium in the inner ear surface in a thin stratified equamous epithelium on the outer surface, with a layer connective tissue between. Sounds waves reaching the tympanic membrane through the external auditory canal cause it to vibrate. Rupture of the tympanic membrane can be caused by a foreign object, thus to the ear. An infection of the middle ear or sufficient differential pressure between the middle ear and the outside ear as occur when changing altitude in an airplane or diving into deep water. Rupture of the tympanic membrane may result in hearing impairment. The second one is the middle ear. The middle ear is an ear-filled space within the petrous portion of the temporal bone that contains the auditory ossicles. Medial view of the middle ear, showing the three auditory ossicles with their ligament and two muscles of the medial ear, the tensor tympani and the stapedius. Medial to the tympanic membrane is the hair-filled cavity of the middle ear. Two covering opening the round and the over window on the medial side of the middle ear separate it from the inner ear. Two additional openings provide air passage from the middle ear. One passage open into the mastoid ear cells in the mastoid process of the temporal bone. The other passageway, the auditory tube or pharyngotympanic tube, open into the pharynx and equalize air pressure between the outside ear and the middle ear cavity. Unequal pressure between the middle ear and the outside environment can distort the tympanic membrane, dampen its vibrations, and make hearing difficult. Distortion of the tympanic membrane, which occur under these conditions, also stimulate thin fibers associated with it. Because of these distortions, with a person changes attitude, sounds seem muffled and the eardrums become painful. Swallowing, yawning, chewing, and holding the nose and the mouth shut while gently pursing out of the lungs can relieve distortion of the tympanic membrane. These actions open the auditory tube, which allow air pass through the auditory tube and equalize air pressure on each side of the eardrum. The middle ear contains three auditory ossicles: the mollusc, the earncus, and the stapes. The auditory ossicles transmit vibrations from the tympanic membrane to the ovar windows. Like a flexible bony bridge, the auditory ossicles form a physical connections between the tympanic membrane and the inner ear. The handle of the mollusc is attached to the inner surface of the tympanic membrane. Vibration of the tympanic membrane causes the mollusc to vibrate as well. The head of the mollusc is attached by a very small synovial joint to the encos, which is attached to the by a small synovial joint to the stapes. The foot plate of the stape fit into the synovial windows and is held in place by a flexible annular ligament. Thus, movement of the tympanic membrane is a convey through the mollusc encos and stape to the ovar window. Two small skeletal muscles originate from the bone around the middle ear and insert onto auditory ossicles. The tensor tympani muscles is attached to the mollusc and is inverted by the trigeminal nerve. The spadius muscles is attached to the stape and is converted the facial nerve. The last one is the inner ear. The inner ear comprises the cochlea and semicircular canals. The cochlea is a spiral-shaped structure about the size of a pea. It is a nestle in the bone of the skull and is filled with fluid. A thin membrane with 1,000 of microscopic hair set this fluid. Each hair is toned to a particular pitch and connect to the hearing nerve that transmit the message to the brain. The tunnels and chamber inside the temporal bone are called the bony labyrinth. Because the bony labyrinth consists of tunnels within the bone, it cannot easily be removed and examined separately. Then, bony labyrinth is lined with endosteum. When the endosteum is what is depicted inside the bony labyrinth is a similarly shaped but smaller set of membranous tunnel in chamber called the membranous labyrinth. The inner surface of the endosteum and the outer surface of the membranous labyrinth are covered with a very tiny layer of cells called the perilymphatic cells. The membranous labyrinth is filled with a clear fluid called endolymph, and the space between the membranous labyrinth and bony labyrinth is filled with a fluid called perilymph. Perilymph has a low concentration of potassium and high concentration of sodium. Similar to cerebrospinal fluid, endolymph has a different composition that perilymph, and the endolymph has a high concentration of potassium and low concentration of sodium. The structure of the inner ear are embedded in the temporal bone. The membranous labyrinth seen within the outline of the bony labyrinth, a cross section through a semicircular canal, and a cross section through the cochlea show the relationship between the bony and a membranous labyrinth. That's all. Thank you.
Parts of the ear. External ear. External auditory canal. External auditory canal, also called external auditory meatus or external acoustic meatus. Passageway that leads from the outside of the head to the tympanic membrane or eardrum membrane of each ear. Lobule. Since the earlobe does not contain cartilage, it has a large blood supply and may help to warm an ear and maintain balance. Tragus. The tragus is a small pointed eminence of the external ear, situated in front of the concha and the projecting backward over the meatus. It also is the name of hair growing at the entrance of the ear. Pinna. The outer ear consists of the visible portion on the side of the head known as the pinna. The purpose of the pinna is to catch sound waves, amplify them slightly, and funnel them down the ear canal to the tympanic membrane or eardrum. Temporal bone. The temporal bones are two major bones in the skull or cranium. They help from the sides and base of the skull, where they protect the temporal lobe of the brain and surround the ear canal. Parts of the ear. Middle ear. Auditory ossicles. The auditory ossicle transmit vibrations of the tympanic membrane through the middle ear to the oval window. The auditory ossicles are the malleus and cos and stapes, and they are found within the petrous part of the temporal bone. Malleus, the most lateral and largest of the auditory ossicles in the malleus. And the malleus, also known as the hammer or mallet, is the largest of the three small bones in the middle ear. The malleus functions with the other bones to transmit vibrations from the eardrum to the inner ear. Encos. The encos is the middle auditory ossicle. The encos transmits vibrations from the malleus to the stapes. The vibrations then move to the inner ear.
Parts of the ear, middle ear. Stapes. A small stirrup shaped bone in the middle ear, transmitting vibration from the encos to the inner ear. The stapes bone is essential to our ability to hear. Tympanic membrane. The tympanic membrane is also called the eardrum. It separates the outer ear from the middle ear. The middle ear bones then transfer vibrating signal to the inner ear. Tympanic membrane, also made of a thin connective tissue membrane covered by skin on the outside and mucosa on the internal. Parts of the ear, inner ear. Semicircular canals. The semicircular canals are part of the inner ear. They are lined with cilia and filled with the liquid substance known as endolem. Semicircular canals are three very small tubes whose primary job is to regulate balance and sense head position. Branches of auditory nerve. The auditory nerve is a bundle of nerve fiber that carry information between the cochlea in the inner ear and the brain. The auditory nerve is used to transmit signal from the internal ear to the brain. Vestibule. The central cavity of the bony labyrinth of the inner ear of the parts of the membranous labyrinth that it contains. This is the area of the inner ear cavity that lies between the cochlea and semicircular canal, also assisting an equilibrium. Cochlea, a hollow tube in the inner ear of a higher vertebrates that is usually coiled like a snail shell and contain the sensory organ of hearing. The cochlea is the auditory area of two inner ear that changes sound waves into nerve signal. Round window, a round opening between the middle ear and the cochlea. The round window is one of two openings from the middle ear into inner ear. Eustachian tube. The Eustachian tube connects the middle ear to the back of the throat. The tubes help the ears drain fluid. They also keep air pressure in the ears at the right level.
Normal hearing. An adult is classified as having normal hearing ability if their responses indicate they hear noises between 0 and 25 dB across the frequency range. A child is considered to have hearing ability within normal limits if their responses are between 0 to 15 dB across the frequency range. The actual organ of hearing is the cochlea in the inner ear. The cochlea receives sound waves and passes them on to the brain. This works smoothly in people with normal hearing.
Abnormal hearing. The abnormal hearing is hearing loss can be classified as conductive, sensorial, or both mixed loss. Conductive hearing loss occurs secondary to lessons to the internal auditory canal, tympanic membrane, or middle ear. These lessons prevent sounds from being effectively conducted to the inner ear. So the hearing loss can be classified as conductive, sensorial, or both mixed loss types of hearing loss. So an abnormal hearing happens when hearing don't have normal result. This does always mean you have permanent hearing loss. Some types of hearing loss may get better on their own and another can be treated or reversed. So hearing loss affects people of all ages and can be caused by many different factors. Then the basic categories of hearing loss are sensorial loss, conductive hearing loss, and the last one is the mixed hearing loss.
There are different types of hearing loss: sensorial, conductive, or it can be mixed hearing loss. This is the area of sensorineural hearing loss. In a sensorineural hearing loss, a person is having issues in the inner ear, cochlea, or acoustic nerve. Damage to these structures can occur due to exposure to loud noises, illness, autotoxication, or it can happen simply due to genetic or the aging process. There is no medical or surgical method of repairing the tiny hair, like cells of the inner ear or the auditory nerve, if they are damaged. However, sensorineural hearing loss can be treated with hearing aids or cochlear implants depending on the severity of the loss. Conductive hearing loss. A conductive hearing loss occurs when something prevents sound from passing through the outer or middle ear and into the inner ear. Conductive hearing loss caused by other abnormalities like stenosis of the ear canal, exostosis, otosclerosis, and ocular chain discontinuity are more difficult to treat medically and may be considered a permanent hearing loss. These conductive losses may be treated with either standard hearing aids or bone-ensured implantable devices. Mixed hearing loss. Mixed hearing loss include both conductive and sensorineural hearing loss. In some cases, a person may be suffering from both a sensorineural and conductive hearing loss. In this instance, the issue is classified as mixed hearing loss. Treatment option for mixed hearing loss will depend on whether the loss is more sensorineural or conductive in nature. If a greater portion of loss is caused by a conductive component, surgical procedures and other medical treatment might be more effective in correcting the hearing concern. If a greater portion of the loss is sensorineural, hearing aids or implantable devices may be the best option.
Disease of hearing. Otitis media. Otitis media, an inflammation of the inner ear caused by a bacteria or virus that causes fluid to accumulate behind the eardrum. Otitis media can occur as a result of a cold, sore throat, or respiratory infection. Otosclerosis. Otosclerosis, the abnormal growth of the small bones in the middle ear. It is one of the most common causes of gradual hearing loss in adults, but hearing can be recovered with surgery. The cause is unknown, but risk factors include family history, gender, and pregnancy. Treatment options include surgery and hearing aids. Presbycusis. This is age-related hearing loss, the gradual loss of hearing adults as they grow older. It is usually bilateral and symmetrical, meaning it occurs at the same. Presbycusis is a complex and multifactorial disorder characterized by symmetrical progressive loss of hearing over many years. It usually affects the height, frequencies of hearing, although its presentation and clinical course can be variable. Acoustic trauma. This is damage caused to the ear by a sudden, loud noise such as explosion, loud machinery or music concert. The injury or damage to the hearing mechanisms located in the inner ear. The injury can be related to one every loud noise such as explosion or by exposure over a long period of time to lower volume loud noise such as machinery. Hearing loss impairment. Hearing loss impairment, the difficulty to hear due to partial, unilateral, bilateral, or total hearing loss. It may be hereditary or the consequence of an illness, traumatism, long-term exposure to noise, or aggressive medication for the auditory nerve. Hearing loss makes it hard to hear or understand sounds. This happens when there is a problem with one or more parts of the ear.